Hello, I'm Dr. Jeffrey Watson, and welcome back to the Healthbeat Show. Today, we've got a wonderful show for you. We're going to be talking some about a new treatment for hepatitis C. You know we have a cure now, so Dr. Ralph Peterson will be talking to us about that. We'll be talking some about women in science with Kat Bobineau, talking about her background and training in biology. Also, we'll be talking to women physicians such as Dr. Cherry, who tells us what it's like to be a woman in healthcare today. We'll be talking also about some of the radiologic tests that you can do for Alzheimer's disease, for lung problems, for heart problems, right here on the Healthbeat Show. I'm Dr. Jeffrey Watson. Remember that if you knew better, you could do better. And welcome to the Healthbeat Show. I'm Dr. Jeffrey Watson, and today I have a very special show for you with one of the top specialists in hepatitis C in the world, and that is in Dr. Ralph Peterson. Dr. Ralph Peterson, how you doing, Dr.
Well,
Peterson?
thank you for those compliments.
It's good to see you. So you're a gastroenterologist.
Yes.
That means you take care of the stomach, the intestines, the liver, the colon, pancreas, all the stuff from about here to here.
Yes.
And traditionally, a lot of stomach doctors do scopes, endoscopes,
Yes.
and colon scopes and so on, but not, I don't think I know of any other stomach doctors who are doing work on hepatitis C. And that's what is hepatitis C anyway?
Well, hepatitis C, well, first of all, you know, as a GI doctor, the liver is very much part of what we study. So I get patients referred to me with abnormal liver functions, and we work them up for a variety of liver issues, not just hepatitis C, but they could have fatty liver, they can have alcoholic liver disease and drug-induced liver disease. So for other reasons, we find that the liver is involved. There's a subspecialty of gastrointestinal diseases called hepatology. And that's just folks who not only gastroenterologists and not only internists as well, but those that just really submajor in just the liver. Mm-hmm. So when you start talking about hepatitis C virus, you know, there's three viruses to worry about: hepatitis A, hepatitis B, and hepatitis C. Mm-hmm. A is pretty much one that does not lead to chronicity. B and C, that's the one that lead to chronicity.
When you say that, you mean it could be that it's ongoing.
It's ongoing.
It continues to make you sick or maybe get worse.
Yeah, continue to involve the liver. Mm-hmm. More importantly, if you look at why people get liver transplant today, hepatitis C is the reason that they get liver transplant. It's the number one reason why people get liver transplant today. Mm-hmm. And so the big push has been, how do we treat hepatitis C virus? We didn't discover it until 1989 anyway.
Yeah, I was going to say, when I was in medical school, I'd never even heard of hepatitis C. There was only hepatitis A and hepatitis B.
Yes, and then you heard non-A, non-B.
They called it, there was this strange thing called non-A.
We knew it wasn't A, we knew it wasn't B, but it was non-A, non-B, yes. And they finally eventually discovered at NIH that hepatitis non-A, non-B was in fact hepatitis C.
That's what they said.
So a lot of the blood transfusion that we gave folks before July 1990, we gave them hepatitis C. So a lot of people contracted hepatitis C.
So they didn't test it? They
didn't know how to test it.
They didn't know how to test it before 1990.
Absolutely. Mm-hmm.
Wow. So is blood transfusion the only way you can get the hepatitis C?
Well, after 1990, you don't get it that way. But the other ways that you can get hepatitis C is, of course, IV drug abusers. They get it that way. Anywhere that there's blood that can be shared. Mm-hmm. So razors, toothbrush, tattooing is a big way that we see hepatitis C. Everybody worry about that. If I have hepatitis C, can I sexually transmit it to my partner? Mm-hmm. A very low percentage, something like 2%, maybe 5%. I wouldn't say no, but we tell folks, if you have hepatitis C, you don't have to protect yourself with your wife. Usually, or with your significant other. Usually you have to have multiple sexual partners to pass on hepatitis C. Vertical transmission between the mother and the baby, very low percentage.
I'm Dr. Jeffrey Watson. You're watching the Healthbeat Show. Stay tuned. We'll be right back after these very important messages.
We share joy. We share madness. But sharing isn't always caring. like when you share a needle, or when sharing pleasure crosses the line. Like when you share blood through the tattoo gun, sharing may cause a fall, because sharing infected blood can cause hepatitis C. HCV is 10 times more infectious than HIV. Consult your doctor. Go, get yourself tested.
Hi, I'm Janine Turner, Administrator of Preventive Care Pathways at the James A. Watson Wellness Center, and you're watching the Healthbeat Show.
I'm Dr. Jeffrey Watson. Welcome back to the Healthbeat Show. Remember that your body is made up of about 80% of water. Just like Mom said, you need to drink about 8 glasses of water today to stay hydrated, to let your muscles work well, your electrolytes work well, and especially if you're exercising, to remove that lactic acid from your body. Stay tuned. We're right here on the Healthbeat Show. I understand there has been treatments, but the previous treatments for it, to my knowledge, there was a medicine, interferon,
Yes.
and then an HIV-like medicine, which made people very sick.
Yes.
And they didn't, it became my experience that it wasn't worth the treatment. They got so sick.
Yeah, when we first started treatment after they discovered that it was not non-A, non-B, it was actually hepatitis C, when we first started treating with interferon at NIH, you only had a 4% success rate. And you had to take 4%. We were taking interferon on a daily basis or 3 times a week, and now we got it to weekly. And you were being treated for at least a year, sometime a year and a half. When they added ribavirin to that regimen, then we saw more success rate. We started approaching 25 and 40 and 50% success rate. In 2011, they came up with 2 new drugs, telaprevir and bocephevir. I didn't like them. I didn't treat at that time. I worked up the patient, sent them to hepatologists for them to be treated, but I didn't treat them because those drugs weren't very friendly to the body. A lot of side effects. A lot of side effects.
Were they also HIV-type medicines?
No, these were, what they discovered then was that there was a protease inhibitor for the enzyme that the virus needed to just attach inside the liver cell, and that if we attack that enzyme, we can actually kill this virus. In fact, the success rate went to about 70%, but once again, you were being treated for a year. December the 6th, I specifically remember that day, 2013, Gilead came out with a drug called Sovaldi. Sovaldi attacked how this virus replicated and how it packaged itself. And that became a game changer. Treatment went from 1 year, Jeffrey, to 12 weeks.
To 12 weeks?
12 weeks.
3 months?
3 months. And we're talking about a 90% success rate.
A 90% success rate?
Kill rate, 90%.
I'm Dr. Jeffrey Watson. Did you know that if you're fasting, a blood sugar above 126 is diabetes, or if you have eaten something and your blood sugar is above 186, that's diabetes. We'll be talking more about diabetes and how to prevent it on the Healthbeat Show. Stay tuned. I'm Dr. Jeffrey Watson.
Well, Thomas, you've got prediabetes. But with more exercise and a change in diet, it can be reversed.
I've tried exercising. It just makes me hungry for bacon.
I love bacon, too. And who really likes to exercise?
Not me.
Me neither.
Nobody. So we're good?
What? Oh, you still have prediabetes. Big time.
And welcome back to the Healthbeat Show. I'm Dr. Jeffrey Watson, and welcome to the Healthbeat Show. Today we're talking some about women in science, technology, engineering, and mathematics. And joining me today is the most brilliant Dr. Amina Cherry, one of the young doctors that has gone through the whole process of studying science and technology. Welcome to the Healthbeat Show, Dr. Cherry.
Thank you so much.
And tell us a little bit about yourself. Where are you from? Tell us a little bit about your background, where you went to school, and so on.
So I was born and raised in West Oakland, California.
Homegrown.
Down the street, actually. And then I received a scholarship to go to Duke University.
Now, you and I were talking, currently you're doing what? You're still in part of the educational process. You're a resident
I'm
right
the
now.
chief resident at USC's Family Medicine program.
Okay. And healthcare has changed. I mean, it's changed from the time that I joined my dad in practice here in Oakland, California. He was probably like the difference in age that you and I maybe are. And he had a peak of wisdom at that time where I maybe was peaking in science and academic knowledge. The two coming together, I thought, worked very, very well because, well, nothing can beat wisdom. And certainly today we have technology, which we're talking about science and technology. How do you think that healthcare has changed? We've got computers now. We've talked about that. Everything is on the computer. We've got the whole Affordable Healthcare Act changing. We've got insurances changing and the structures of facilities. More women are in medicine now. So tell me, what are your thoughts about how the healthcare system, as a young physician blossoming, what would be your thoughts about it?
I think it's very exciting to be a part of healthcare right now with so many changes happening, so many areas for growth happening. Now that research and evidence-based medicine has become a large portion of healthcare, and we're at this point in American healthcare where we're trying to grapple with costs and cost containment, but then still giving quality evidence-based care. The patient-centered medical home model is huge and has shown great gains within family medicine. The reemergence of the importance of the primary care physician as opposed to going to a specialist for a minor problem. I think that healthcare right now is very exciting. There's a lot of huge changes going on that I think will ultimately benefit the patients if we can get doctors to get on board with those changes and go forward. So I'm very excited to be a part of healthcare right now.
Do you see it, you know, of course in different countries they have socialized medicine. Canada has the Canadian healthcare system where everybody's insured. Here we have, as you've talked about, the patient-centered medical home, and that's kind of what our office is. And then you have accountable care organizations, which are things like Kaiser, where the doctor is hooked to the hospital, is hooked to the clinic, is hooked to the pharmacy, is hooked to the lab, and the EMR. Where do you see young physicians going right now? And as we think about the community, today we spent some time going out into the community and we're looking at how do we address the needs of our folks in the community. What types of things do you think we need to look at such that we can address the patient population at need, that being the African American population that has disparities in disease? That's a mouthful. That's a mouthful, but our folks, dealing with our folks.
Right.
How could you see that young people can come out and address those issues?
So I think that the solution, there's a lot of different ways to attack that problem. And then also multiple ways to skin a cat. I think that some of the disconnect comes from, like we were talking about earlier today, the fact that I am well trained and well able to work in a hospital. I'm well trained and well able to work in a system like Kaiser. I'm well trained and well able to work in a community clinic that has a lot of resources, but I'm not that well trained to be able to work in a community clinic that does not have an electronic medical record, where things are not set up for me and all I have to worry about is medicine. And I think the reason why is because we're trained in residency and we're trained in medical school to know the medicine. That's what we're trained to understand the diagnosis and understand what it takes to treat the diagnosis. We're not trained to understand and treat all the social disparities that actually relate to whether or not your patient has a better outcome. So, you know, I have patients who have diabetes, for example, and I'm giving them insulin and my regimen is perfect and everything goes well, and then one day their sugar is low and I have no idea why. Turns out my patient has problems with food security. I am completely ill-equipped to deal with that. And it works out fine when I'm at a large organization that has case managers, but doesn't work out so well if I'm in my own community clinic that doesn't have access to that resource. And also that resource is right there in the clinic. My case manager is down the hall. I go and I knock on her door and I say, help. You know? But if I had to get someone in the community hooked up with that, or hooked up with those resources without that person being right there, I'm not well trained to work in those environments. So I think in terms of bridging the gap, you know how to do all those things. And that's where that education needs to happen. And I'm not sure if within residency or within medical school is the time where it needs to happen, or afterwards. Family medicine is thinking about going to a 4-year program. That's where the bridge needs to be.
And we are so glad that you're here, though, because those are the kind of things I want to talk with you about. And today we worked with some visiting nurses, and the visiting nurses also have social workers and case managers. I just got off the phone with somebody that their insurance lapsed, they can't get their medicine, but the visiting nurse and I came up with a plan to make sure that the person could get taken care of. So there is a whole another system and process that involves outreach into the community. And I just want to say that I'm so proud of you.
Thank
and
you.
We're so glad that you would take the time to come here and to come back home to learn about the types of things that are going on in the community that you grew up in. And I'm so proud to see you as an African American woman also, as we talked about science, technology, engineering, and math that has utilized those skills. All right, we're here with Dr. Amina Cherry. I am Dr. Jeffrey Watson, and we are with the Healthbeat Show. Stay tuned. Stay tuned for the Healthbeat news after these very important messages.
Thank you, dear. Well, you're very supple, just like I was at your age. Back then, I was a sex expert. Used to call me the buttered biscuit. I know about birth control, too. So you can ask me anything, baby.
Bedsider.org has birth control information and a lot more. And it's...
Have you had sex in this car yet?
I'm Dr. Jeffrey Watson, and you should know your numbers. A lot of people don't know what high blood pressure usually is. Any number above 140 on the top number and above 90 on the bottom number is considered phase 1 of hypertension. If your blood pressure is above 160 on the top number and 100 on the bottom number, that's phase 2 of hypertension. Now, African Americans make up about 12% of the U.S. population, but they make up greater than 30% of all people with high blood pressure. High blood pressure is associated with heart attacks, it's associated with strokes, and it is taking us out at a disproportionate amount. Make sure that you keep a low sodium diet. In other words, don't sprinkle any salt on your food, and look on the boxes, look on the cans, take in less than 2 grams of salt a day. Keep your weight down and try to keep that stress down. Go for walks, go for jogging, and try to meditate and think about those things that are bringing you stress and try to take those away. High blood pressure is thought to be a silent killer, but if you have pounding in your head, if you're feeling dizzy, if you feel tense, if you are fatigued or you have palpitations in your chest, these may be signs and symptoms of high blood pressure. Talk to your doctor about it. I always say that if you knew better, you could do better. I'm Dr. Jeffrey Watson, and remember always that your health is your wealth, and when you have your health, you have everything. I'll see you next time. And welcome to the Healthbeat Show. I'm Dr. Jeffrey Watson, and welcome back to the Healthbeat Show. Today we're going to be talking some about women in science. And joining me today is none other than Miss Kat Bobineau. Good afternoon, Miss Bobineau.
Good afternoon, Dr. Watson.
And I understand that you are a scientist yourself.
I am.
That is correct. You are a biologist.
That is correct.
And tell me, what is a biologist? What is biology all about?
So biology is kind of the study of life. So you can take biology in many different fields. I chose to do two different things. One is ecology-based, conservation ecology. So I like being outdoors. I like working with wildlife. And the other part of it is science education, where I do STEM outreach, and I talk to youth about going into careers in STEM.
And that seems to be, what does STEM stand for?
So STEM stands for science, technology, engineering, and math.
Okay. And, you know, that seems to be an area that is extremely important when we're looking at young people and their capability of going on to college or going on to any professional ranks. Are there, as far as you know, are there any real studies or analysis about how children do as it relates to this type of education, science, technology, education, and math?
Well, there are some studies that's out there, and what it's telling us is that America as a whole, we are lacking with our kids going into STEM, or science, technology, engineering, math, and because of that, we need to rev up and introduce our kids to it earlier, talk about it in our early time of when they're in elementary school, even before if you can, and get them interested in these type of fields. Now, the problem also rests with the teachers and getting the teachers their education when it comes to science. And unfortunately, a lot of teachers who are in elementary, they don't have a science background. So for them to introduce that thought process to them, they don't really have a grasp of what they should be teaching, which is okay, but we just need more people who have a science background who are going to teach the kids how to go into it.
Now, my kids are actually in the 6th grade right now. I have twins. And it's my understanding, is 6th grade kind of a pivotal year as it relates to that?
It is a pivotal year. There have also been some studies with young girls who, around that age, they decide that science isn't cool, they don't have a good role model in science, and so they start to recede into themselves and not answer the science questions, even if they do know the answer. And it's also been noted that teachers will call on boys faster than girls when it comes to that subject. So boys are getting a step up in these fields or in the classrooms, and when the little girls, they also need a hand.
What about the job environment? When we talk about the job environment, you know, okay, I'm a physician, and we'll be talking to some other people in the health sciences today, as well as you, who is a scientist. But what about computer science and all of these jobs that are in the technology industry right now? Are kids being prepared, and particularly African American kids, to enter into these types of professions?
It depends on their schooling and what their programs are teaching them, but most of the time, no. But there are other programs that are outside of the school that people can put their kids in, and they can learn these type of things, like coding. Like, for one example, is Black Girls Code. I've heard of it. I've met the owner who started it, Kimberly Bryant, and it's an awesome program.
I heard her on the radio, I think, yesterday.
It's an awesome program that teaches primarily girls of color all about coding and how to learn how to do it. And then, but she's not the only one. There's so many other programs out there that teaches kids about coding. It's just if parents were willing to spend that extra time outside of school to take them to those programs.
Well, it's such an important thing. Certainly in healthcare, biology is a key thing. And now, do you have a particular program in which you are working with young people? I understand that you have a YouTube television show that you're educating people about. Talk to me about that a little bit.
So I have a show, it's called In the Know, science show with Kat Bobineau, and it all rhymes. But Basically, what it started off with was my thesis. And so my thesis for my master's is Women in STEM in the Media and Its Perspective for Young Girls. So I've been going around the Bay Area interviewing different women in STEM professions. So at Chabot Space and Science Center, Exploratorium, the San Francisco Zoo. And the thought process behind that is to give kids an idea and their families what jobs are out there if they go into STEM. So for example, I've always loved animals. And so everybody in my family has told me to be a vet. But veterinarians are not the only jobs that you can do when you work with animals. You can be a biologist, an ecologist, a mammologist. So my goal is to interview different people in different professions so that people have an idea of what's out there for them.
Okay. Well, In the Know with Kat Bobineau.
That's right.
We'll be watching for that, and we really appreciate you being here and talking with us about the STEM programs and about women in STEM programs. And certainly that would be the pathway that would take one to the healthcare training as well, which we know is a major, major thing in our country today.
Absolutely, and it will never go away.
It's going to be here for a long time.
That's right.
All right. Well, God bless. Thank you so much.
Thank you for having me.
All right. Take care. And we'll be right back here on the Healthbeat Show. I'm Dr. Jeffrey Watson. I'm a board-certified internal medicine physician, and I've been in practice now for over 30 years. I'm a professor of medicine. I teach students how to become young doctors, nurses, nurse practitioners, physician assistants, and I want to teach you how to prevent disease and maintain your health. Never has there been a time that it's been so important that you try to educate yourself on how to prevent diabetes, hypertension, stroke, HIV, hepatitis C, cancers, all the types of things that are out there that will take us away at an early age. Watch the Healthbeat Show, where you will hear me say that if you knew better, you could do better, because your health is your wealth, and when you have your health, you have everything. I'm Dr. Jeffrey Watson. We'll see you next time.
You're